Hello, everybody. My name is Benjamin Day,
And I am Jillian Mason.
and this is Medicare for All, the podcast for everybody who needs healthcare.
Mm-hmm.
So, Jillian, it is our 100th episode, and we are going to celebrate the only way that we know how by
Ah,
sharing our predictions of the grim apocalyptic future that surely awaits us if we fail to get our healthcare system together. You may recognize this theme from
yeah.
such times as 99 other episodes. But this time we are going to be talking about the next pandemic. And if experts are right, this could be a lot sooner than we think, unfortunately. So, in addition to several somewhat less familiar pathogens on the rise this summer, COVID is back. And this time it's FLiRTy. We'll explain what that means, sort of. Today, although thinking of a flirty COVID requires very little extra explanation. Today we're going to get into some of the outbreaks currently threatening to explode into our next global disaster, and especially explore how prepared our for-profit healthcare system is to keep us safe. Spoiler alert, it is not. So, Jillian,
Wow.
you were the one who threw us under the bus here. Your idea to spend our 100th episode discussing a topic that is both terrifying and depressing. So, what prompted that decision?
Well, Ben, it's simple. I had no idea this was our 100th episode until I actually sat down to write the outline. I
Happy
was like,
100.
which episode? Oh, episode 100.
Mhm.
And then we had already said that we would do it about the pandemic. So I wanted to stick with that or whatever. So maybe we'll celebrate at some point in the future. But also, okay, here's the thing. This emerging new pandemic situation is very serious and more people need to be taking it seriously, I think. So it's important for us to talk about. So on that serious note, very smart Forbes healthcare reporter Alex Knapp has called this summer of 2024 hot virus summer.
Oh, that's cute.
It is cute. Do you know the reference? Do you know the reference, Ben?
No, I
Oh
know
my
I've heard of the
God.
reference, but I don't know the. Yeah.
Okay. Well, this obviously is a parody of Hot Girl Summer, which is a song by Megan Thee Stallion, which was embraced as now the slogan for every hot girl's summer. Anyway, like I said, hot virus summer. So this is his term, not mine. And honestly, the rest of it just gets more and more serious as it goes along. So, all right. As you mentioned, COVID is up again, right? And we have these new flirt variants. I think they just want to communicate that it's promiscuous.
I see. Yeah. And, it's important to point out, of course, that COVID never really left. So we keep saying like COVID is coming back or returning. Not exactly true. In 2023, 75,000 people still died from COVID and nearly 1 million were hospitalized. And plenty of people are still suffering from long COVID, which we still have not figured out. There are 34,000 new cases per week globally. And it's spreading, of course, because it is extremely hot out and we are all inside together in the air conditioning, kind of like we do in the winter time when there's always like an outburst of during, especially the holiday breaks in December. So.
Yeah, a lot of the folks, the climate scientists, are pointing out that this is one of the ways in which the climate is actually impacting our, the transmission of viruses, right?
Yep.
Yeah. We'll get to more about climate science later on, though. Anyway, the other another major threat here is bird flu, and I feel like I've been hearing about bird flu since like the 90s or so, and I've been scared of it. So, I mean, I guess, okay, so did you ever play the game Plague, Ben? This is a little bit of
I don't think so. No.
Okay, so there was this game, it was like for your iPhone or whatever, and it was called Plague. And it was basically you play as an infectious virus, and your goal was to conquer the world. This was like much more fun before COVID, as you might imagine. I think they might have taken that down during COVID, that game. So you might not be able to play it now. Anyway, the point is that the way to win this game, and remember, you're playing as the virus, so winning is the death of all of Earth's population, was always to mutate your virus so that it could be transmitted by birds. Because you know what? Birds don't know borders, Ben. They just fly all over the place.
Worse than ticks?
I mean, ticks ride on birds.
Cows, bovine.
Okay. Well, let's get to the bovines in a second. So, all right. So, historically, the bird flu has mostly infected birds.
Okay.
This is why they call it bird flu. It's right there in the name. But it's evolving, and it has begun to infect mammals. For now, that's like mostly livestock, right? So far, we have 129 dairy herds in 12 U.S. states that have been infected. So honestly, this is not, if you work in an animal-related field, this is not at all new to you. If you work in the dairy industry or in farming or whatever. So basically, like, as far as animals are concerned, this is actually already a pandemic, right? It's impacting industries all over the world, and it could cause a serious shortage of meat and dairy, all these different things, right? So
is my cheese safe?
Is
pizza going to kill me?
It actually, you and all of our listeners will be comforted to know that that it actually is not passing on to dairy, because we pasteurize our dairy, which kills the virus. So when they actually look for the virus in commercially available dairy, what they're finding is that they are finding large samples of dead virus, right? So it's not going to infect you.
So only the people in the unpasteurized milk movement are going to.
I was just going to say that. Ben lived in Jamaica Plain, one of the hippie neighborhoods. Well, not just a hippie neighborhood, but that's one component. Bougie hippies, and they are really into the raw milk, and they need to chill on it right now.
Yeah,
for sure. So anyway, right. So I know what you're thinking. You're like, Jillian, why are you freaking out? This is just an animal thing. But unfortunately, there have been cases of the virus that have actually spread to humans. In the US, we now have 3 cases since March. So this virus is evolving rapidly to the point where it can actually infect humans. And what you should know is that around the world, more than 50% of the actual people who are infected with bird flu die from the virus.
Whoa.
Yeah.
Poor cows.
Yeah, also poor cows. I mean, I don't want to I don't want to diminish the suffering of the animals here, because that is really shitty. But more than 50% of the people who are infected with the bird flu actually die from the virus. And of the 3 people who have actually gotten it so far in the US, right, they all worked on farms, right? So they were all in direct contact with birds and livestock. And right now, the CDC is just limiting their warnings about bird flu to people who actually also work in close contact with animals, farm workers, people who work at dairy processing plants, and veterinarians and the whatnot.
Well, you may not know this, Jillian, but all 3 of those farm workers also met with somebody who worked at a Chinese lab, and there are theories out there. Right. I'm just saying. Yeah,
that's right. Actually, I don't think this theory has started yet, so this might be a good opportunity to get in on the conspiracy game. So
I'm gonna hop on Twitter.
All of those Chinese lab working farmers got that. They were actually fine, though. By the way, they had some pretty mild cases, which is great. But the scientists are warning that, at any time, this virus could mutate so that it can actually become transmissible between humans. At which point we'd be epically fucked, right? And I know, again, you're thinking, Jillian, at any time it could mutate, and because this sounds very silly, but this is actually kind of likely to happen. It happened with COVID. It's happened with SARS. It's happened with any number of different diseases that started out in animals and have mutated into people. And Dr. Michael Greger, who was involved actually in the lawsuit against Oprah for when Oprah claimed that mad cow disease was a good reason not to eat burgers. So Dr. Michael Greger, he testified against Oprah. He is not just going to go with the the popular opinion. He says the question is not if, but when about a bird flu epidemic. And then in general, all of these different public health people are sort of, speaking up at this point. And Scott Hensley, who's a professor of microbiology at the University of Pennsylvania, I think hit the nail on the head when he said, it almost seems like a pandemic unfolding in slow motion. Isn't that terrible?
University of Pennsylvania, that's not a credible source, is it? No, that sounds terrifying. I have to admit, I looked through kind of the World Health Organization list of like possible pandemic viruses, and bird flu is not the number one on my list to fear, but that's mostly because some of the other possible pandemics are just so terrifying in terms of their symptoms, like Crimean Congo hemorrhagic fever. I'd like to submit that one for consideration as worst possible pandemic. But it sounds like what you're saying is that bird flu is actually playing out in real time, like right now, in animal populations, and starting to already mutate into being able to impact humans. So
it just feels like the kind of moment that we might look back on in 5 years and be like, God damn it, I wish we were paying attention.
I think it has a branding problem. We need something aside from bird flu.
Oh, right.
If you call that shit hemorrhagic flu, I'm out.
Yeah, what other health conditions are scary? Hemorrhaging is scary.
God,
Bleeding out disease.
The ones that cause encephalitis are real. I don't want that. That's bad. Brain issues, no good.
Yeah. All of these are really good ideas. Rebranding.
Yes,
is really important. I just wanted to say though that Alex Knapp actually mentioned a couple that aren't on the CDC radar as well.
Okay.
Which are monkeypox, which is having another moment in Central Africa right now, and West Nile virus, which is up all over the world. Again, connecting to.
We had some cases locally here, I think, for West Nile.
Yeah. So those are things that that we need to keep an eye on as well. So there's a lot of shit going on here, Ben, and it's all messed up.
Yeah, I feel like a lot of these pandemics have a PR problem. They need like a better publicist. So,
okay.
And you can't just like up and name every disease after the species that it was first found in, like monkeypox, bird flu, bovine, whatever. Like, come on, scientists, do better.
Yeah. I did think that mad cow disease was
all right.
Was pretty startling.
The addition of mad makes it.
And shout out to my friend from grad school who together we actually wrote a hip hop song called Mad Cow. And maybe someday I'll sing it for you all if I'm really looking to get us new viewers.
Save that for episode 200.
Yes, if we make it to 200, folks, this is what's happening. Anyway, as we all know, right, the best indicator of future outcomes is really to look at how we have fared in similar situations in the past. And luckily, or very much not, the 2020 COVID outbreak is like still very fresh in our minds. And I don't know about you, but what I remember is that we as a nation, will focus on the US here, we're not particularly prepared. So Ben, what were your takeaways about how our public health system reacted when the pandemic first appeared?
Yeah, I mean, public health system and healthcare system kind of in tandem. And I mean, we were just completely fucked. I remember, very early on in the pandemic, I remember when it was mostly not in the US. Remember, it kind of swept through Italy, and all of these conservatives started writing things about how single-payer healthcare is a disaster for addressing pandemics because Italy had a universal healthcare system. And then, of course, it hit here, and we were just so much more screwed than basically every country that had universal healthcare. I mean, every country struggled prior to the vaccine being developed, but we had a bunch of additional kind of unique barriers to coping with a pandemic that just made it way far worse for us in terms of hospitalizations and deaths, and especially the inequities of who was most impacted by just a huge racial gap in who contracted the virus and who was hospitalized and who was killed by the virus. a lot of that is kind of traceable to our private for-profit healthcare system and private health insurance system. You know, we don't spend enough on public health in the US, but our public health systems are decent. But they are not integrated with our healthcare system in any meaningful way.
Ooh, what do you mean by that?
I just meant that, like,
He chuckles.
yeah, well, you know, like in countries with universal healthcare, a hospital is not just providing healthcare. They're really they treat the people in the community around them, right? That's nearest to them. They don't treat like people who they are in network for their insurance plan, you know, wherever they happen to live.
Right.
And also in universal healthcare system, you have there's like a very clear trade-off between not doing public health things that cause higher healthcare costs down the road. So it's just much easier to do things like, well, why don't we just go out into the community and solve this at the community level before people get sick, before they reach the healthcare system. And that's not just pandemics, but that's all sorts of stuff like asthma and diabetes and, you know, treating chronic conditions, things like that. Hospitals will get much more actively involved with public health in countries that have universal health care, because they're like, well, why don't we just do this with public health and spend less money as opposed to spending more money treating people who are fucked later, and also then people have to deal with the health issues and have a lower quality of living. So we don't have that connection between like our healthcare delivery system and public health. Public health is just like a completely separate, you know, it's run by counties and cities and towns and states, largely independent of the healthcare delivery system. And of course, we had to rely on private companies for like all the preventive measures, like having enough protective PPE, the protective equipment that providers need and famously did not have, and they were completely screwed during the pandemic. And of course, vaccines. I mean, even vaccine, like being able to pay for access to vaccines and vaccine distribution, we don't have a system for paying for that either.
Which is so messed up, right? Because like I always have to throw this in there that like the vaccine for COVID, like all vaccines, 95% of vaccines was publicly funded. You know, it was all publicly funded. So that's how we arrived at what the correct vaccine would be. And that part went great, I will say. That part went terrific. All those public health people came together and they found a vaccine, and all these scientists and stuff took our tax dollars. And then we turned over the whole process to Pfizer.
Yeah, who are now screwing us and are no longer, they've jacked up all the rates, how much they charge because they can. And you know, vaccines are no longer free and available to everyone, and neither are home tests. You know, even home testing kits, which for a while were being, at least some of them, but although not enough, were being given out for free. A lot of European countries massively subsidize the home tests, and now there's no free home tests at all for anyone, I don't think. So that whole program has ended. It feels like everything we did that was to kind of make it through the pandemic, including like all the emergency public health and healthcare measures. You remember we like extended Medicaid, let everyone stay on Medicaid without like kicking them off and doing redetermination all the time. Almost everything has disappeared, and all the infrastructure that we built up to make it through the COVID pandemic is gone now. I mean, I don't think any of it is really left. And I guess the last aspect of this that I would bring up for you that we really have to think about when we're confronting possibly the next pandemic is this dynamic that is just kind of fundamental to how US healthcare works, which is that during pandemics, people stop going to hospitals because hospitals are crowded and people are worried about getting infected while they're there. So everyone was canceling their elective procedures and surgeries and stuff. And that is what all hospitals rely on to make money, and specialists, a lot of physicians as well. And so basically during this,
I'm sorry.
No, go for it.
Not interrupt with it. I had a colonoscopy scheduled for September of 2020, and I still haven't gotten it. I still don't know what's going on down there. Anyway, continue.
All right. I hope you have no
we're
GI
delaying.
issues. Yeah, I wonder if that's probably a common story for everyone. I bet you a lot of people just kind of like fell outside of their healthcare routines during the pandemic.
But little did we know we were putting a dent in hospital profits.
Right. Yeah, and not just profits, but you know, the hospitals started laying off staff, dramatic cuts across the board, right in the middle of the pandemic when people kind of most needed it. This was like at the same time that, you know, these emergency rooms were just like packed with people and they were like storing bodies in the alleyway and just like the real crazy shit that you think of when you think of like New York City at the height of the pandemic. I mean, that is, you know, it's just the completely wrong incentive. And it obviously, I guess to state the obvious, if you're in a country that has universal health care, hospitals don't lose money when people stop going to the hospital. They have a fixed amount to cover all their operating expenses for the month. It's based on past costs to them. And so you don't see these mass layoffs and shrinking of the healthcare system right when you run into a pandemic and you know you're going to need it, the healthcare personnel the most. So,
yeah. So basically, the fact that is as contrary to what folks said at the very beginning of the pandemic when Italy was getting decimated,
right.
It actually turns out, quelle surprise, that having a for-profit healthcare system actually doesn't improve your response to a pandemic.
Right. And one of the people, this is kind of piling on. Maybe I shouldn't even say this, but
what can we stop you from piling on?
One of the people who pointed at Italy and said that Medicare for All clearly doesn't work because of the pandemic was Joe Biden. I think he was trying to counter the Bernie Sanders wing of the movement. And he's like, look at Italy. But
Joe.
He's got enough problems these days.
oh God. Yeah. The other option for what we were going to talk about today was the debates, but
yeah. We don't want to increase people's
But we
PTSD.
decided that pandemics would be less depressing.
I think so.
Jesus Christ.
At least this one's in the future, right?
Yeah. Right. As opposed to happening right now. Yeah, absolutely. So the U.S. kind of didn't do so great in the pandemic, and I think we all remember that very clearly. Right?
Yeah, and I would just point to the huge racial inequities that we saw in the U.S. That didn't happen in countries that had universal health care to that degree. And again, that's just because our health insurance system is racist, has massive racial inequities, and our delivery system, because you know the hospitals that focus on treating communities of color tend not to make enough money. They tend to go under. They tend to disproportionately be closed or merged out. That there's also a huge just access and proximity challenge for communities of color. So
so messed up. So then I guess the next question, right, is, so if we were to do the whole pandemic over again,
which we will,
and we will,
right?
Not if, when. Yes. So what preventative measures should we actually be advocating for?
I'm going to go outside the box on this one and say Medicare for all.
Wait, hold on. That has to be the punchline. In addition to Medicare for all.
Did I ruin
it? No, you're right. You're right. I was just going to say Medicare for all. But yeah, right. What we need here is we need surveillance, right? That's one of the things that the experts in particular who are monitoring these illnesses that are primarily affecting now animals, right, but are transitioning to people, like actually surveilling the disease and finding out where it is, where the infections are, and tracking the progress of the disease in humans so that they can really isolate the moment when it switches from just impacting animals to impacting humans, right? That is totally critical, right? And something that we did not do during the COVID pandemic. We were pretty behind on that. Testing, Obviously, like you said, right, we need to have testing that's available to everyone the same way it was by the end of the pandemic, right? But we need that from the beginning. That's really important. And then finally, vaccines, right? All of the public health experts are calling for us now to start stockpiling vaccines.
Why can't we have a bird flu vaccine before bird flu completely ravages the country? Wouldn't that be nice?
Yeah. Funny story, a bird flu vaccine does exist. So, so right now, the CDC is saying that we do not, we need more bird flu vaccine
Cool.
in order to survive this. And then some of these are actually like monkeypox, for example, is actually closely related to smallpox. You could actually prevent it with smallpox vaccine.
Okay.
So that's interesting.
As you're talking about surveillance and testing and speaking so fluently about it, I remembered that you actually worked as like a contact tracer for a while.
I did.
Did that give you kind of a window on like how we were doing everything so poorly? Or
yeah, I mean, it was a terrifying window, and at the time, I had just moved to Texas, but I managed to get a job working for the Massachusetts contact tracing program, which was great because Massachusetts had a contact tracing program. Hey,
Texas.
So
funny.
I'll detour a second and just talk a little bit about what we did there, because it was a really great thing, and I don't know if I've ever talked about it on the podcast or not, but it was a collective of people. I don't know why they called it a collective, but it was basically run by a progressive organization founded by Paul Farmer, which is
Partners in Health.
Yeah, Partners in Health. Very good. I wasn't really quizzing you. I actually just forgot the name of it.
That's all right.
Even though I worked
for passed.
For a year. Anyway, so Partners in Health actually joined with the public health departments in Massachusetts in order to help them handle the response to COVID. And so what we would do, let me tell you what they did in other states. In other states, when people got COVID and tested positive, they would have someone from a public health department, the local public health department, who would call them and say, "You got the COVID, now be safe, y'all." And so that was not
stern lecture.
Not tremendously effective. But what we did in Massachusetts was we actually tried to create a more kind of holistic response. So we would call people who tested positive for COVID. We would try to connect them to resources that they needed in order to stay isolated. So putting people up in, there were COVID hotels at one point where people could get rooms if they needed to stay apart from their family or were houseless. All different kinds of psychological counseling, all different kinds of resources that we were able to hook people up with. And what we did was we actually took down the names of the people they had been in contact with. Right. And this is where it differs hugely from the other contact tracing systems in other states, right? In Texas, if you got COVID, you get that call from the local health department, and they'll tell you, you should let anyone who you've been close to know about this, right? But we know that people aren't great at that. So what we would do for the Massachusetts team is we would actually just call people, and we would walk them through the week before they got COVID and take note of everyone who they came in contact with. We would contact stores and businesses they had been in. One terrible time, I had to contact a funeral home where a woman had attended a funeral and caught COVID at the funeral. Oh, it was terrible. But regardless, right? And we would call people anonymously too. So you could be like, "Oh my God, I went on a terrible," and this did happen. I went on a terrible first date with this guy. And I don't want him to not know that he might have COVID, but I also never want to contact him again.
Right.
So we would call and be like, "Not saying who, but you may have been exposed to COVID."
Yeah, possibly on a bad tape.
But you know what? That kind of a system it was a remarkable experience working for that contact tracing project, and a really interesting way to see how like real public health could work if we really coordinate it, you know?
Yeah.
And as you say, coordinate it with healthcare delivery, right? Putting these people into places where they can get medical treatment that they need and deserve.
And this reminds me also of, there is one other way in which the U.S. healthcare system is kind of connected to this public health dysfunction, which is that especially for states and for cities and towns and counties, the exploding healthcare costs are part of the reason why funding for public health is so low and has been dropping.
Right.
Since you're talking about Massachusetts, I mean, we've done sort of, used to do really close analysis of the budget in Massachusetts and how healthcare has gone from taking up, a quarter of the budget to now about half of the budget. And so the state dollars being spent on everything else have been shrinking. And that includes like all the social determinants of health, like housing, but it also includes public health. So you get sort of just the money suck of the healthcare system is draining resources from all of our ability to do anything else that's good and important. So,
yeah, cool.
I like to end on a high note. Yeah.
Well, okay. I did want to just like reminder. Again, the punchline is that if we had a Medicare for all system, a lot of this stuff would be different, right? And I just want to point to one comparatively small but huge way in which things might be different, which is you mentioned that after the pandemic emergency was declared over by the Biden administration, they started what they call an unwinding process of Medicaid, which meant that within the past year, they have been trying to unenroll people from the Medicaid program. Like you said, during the pandemic, right? They didn't bother to reevaluate people who were already on Medicaid, right? So if you were on Medicaid, you stayed on Medicaid. Now they're going through this process of unwinding, and it's been highly controversial. I think that we actually did an episode on this at some point last year, maybe.
Yep.
So you should check that out. But basically, about 23 million Medicaid enrollees have been disenrolled as of June 14th, 2024.
Right.
So right now we have 23 million fewer people with health coverage in this country right now. And we know that over 60% of those people, by the way, we know were unenrolled for administrative reasons.
Right. They are eligible. They just paperwork issues. Yeah.
Maybe it went to the wrong address. Maybe you didn't get a signature in the right place or whatever.
And some states like Florida are basically intentionally creating administrative barriers for people to try and cut their Medicaid budget. So.
Oh my God. In Arkansas, the governor there basically said, oh, we've got a year to kick all these people, to reassess all these people and kick them off Medicaid. We're going to do it in 6 months.
Wow. That's government efficiency.
So gung-ho about that. So, yeah. So I think, we're going into the next pandemic at even more of a disadvantage now because we're going in with fewer people who actually have access to basic health coverage.
Yeah.
So, yeah. Oh boy. So Medicare for all is the solution, and we should all stock up on masks and toilet paper again.
The toilet paper. Oh my God, I forgot about that. Oh my God. There was, I may have told you this, but there was one day when I walked into the local convenience store and they were the whole toilet paper shelf was empty. And we were like running pretty low, but right across from it, the entire adult incontinence shelf was full. Like the adult diapers and stuff. And I was like, maybe this is the emergency solution.
You were thinking about that. That's interesting.
That's how dark things got during those days.
It's not really serious until the adult diapers shelf is
yes.
Yes. Well,
it's a pro tip for the next pandemic.
This has been a really gross episode. So we want to wrap up, and I'll let you do the outro. But while we're here, I thought it might be a good idea to tell our listeners about the recent change in our relationship. And no, Ben is already married. We are not getting married.
Yes, no. So as probably most people know, I left Healthcare Now about a couple months ago. I now work at Friends of the Earth, an environmental organization, which
Yeah.
interesting overlap here with the heat waves and hot virus summer. But yeah, Jillian is the new executive director. All hail Jillian, the illustrious ruler of Healthcare Now and the Medicare for All movement. But since I love the podcast and I love talking with Jillian on the podcast and hearing from you all as listeners, I've agreed to stay on as a volunteer co-host. So I now have no power, but I still have my voice.
Yeah. Right, but I'm still going to write the notes for the show. So there's
that one benefit.
Yeah, so if you notice a change in the dynamic of our relationship, it's because Ben is not my boss anymore.
Exactly.
Tell me what to do.
You sounded a little more free today. Yeah.
Anyway, now we're just besties who do a podcast together, and I love it.
It's still fun. And speaking of besties, I want to thank our best podcast team.
Yes.
Our podcast manager is Angelique Davis. Our show notes writer is Jerry Katz, who, by the way, has also stepped in to be a phenomenal kind of support staff for Healthcare Now during the transition. And our audio editor was Christian Brandt. Thanks so much to the team. Don't forget to like this episode. Subscribe to the Medicare for All podcast on your platform of choice. And the show is a project of the Healthcare Now Education Fund. So if you'd like to support our work, you can donate at our website, healthcare-now.org.
Sounds good. You want to say goodbye to the people, Ben?
I thought you had the ending tagline. Do I say, stay safe and stay dangerous?
All right, folks, stay safe and stay dangerous. Thank you so much. We'll see you again next time.